Hi, hello viewers. I'm Dr. Godhwani, an allergist and immunologist with advanced specialty care. Today I've compiled a list of common questions that my patients ask me regarding food allergy, and I would like to share these with you and give you my responses that I would typically provide. So the first question is, what is the difference between a food allergy versus a food intolerance? A food allergy actually occurs when the immune system overreacts to a specific food with an abnormal response. The symptoms for an immediate type food allergy vary from mild to severe symptoms and typically can include hives, swelling, or difficulty breathing. A food intolerance, on the other hand, does not involve the immune system, and intolerance is often a digestive-related issue. One example being lactose intolerance. A person with lactose intolerance lacks the enzyme that is needed to break down the milk the sugar that's present in the milk, the lactose. And so when a person with lactose intolerance eats milk-based products, they may develop symptoms of gas, bloating, and abdominal pain. The second question is, how common is food allergy? 11% of people age 18 or older, and that's more than 26 million adults in the United States, have underlying food allergies. Results from a 2015 and 2016 survey of over 38,000 children in the U.S. found that approximately 8% of children have food allergies. This is about 1 in 13 children. The next question I often receive is, what are the most common food allergies in children versus adults? So we know that food allergies are more common in children than they are in adults. In the United States, children tend to have food allergies in this order. 1 tends to be peanut, second highest tends to be milk, third highest tends to be shellfish, and the fourth tends to be tree nuts. However, in early life, so for instance those children under the age of 1, we know that cow's milk allergy is the case for 50% of those children under 1 that have food allergy. Among adults in the United States, the most common food allergens are 1 shellfish, 2 milk, 3 peanut, 4 tree nuts, and 5 finned fish. Finned fish, I apologize. The next question I often receive is eczema a sign of food allergy? Now, studies suggest that 1/3 of children with moderate to severe eczema also have underlying food allergy. There is controversy, however, about the degree to which the food allergy contributes to their chronic eczema. But we do know that elimination of common food allergens in some children may help improve their eczema. The role of food allergy in adults with eczema has not been well studied, and it is thought to be less commonly involved in their eczema process. So, moving on to another question that we tend to get quite often is, why do I get itching in my mouth when I eat certain fruits and vegetables? So, people that have pollen allergies can experience itching in their mouth or throat when eating raw fruits or vegetables that have proteins similar to those found in the pollens that the person is allergic to. This is referred to as oral allergy syndrome, and the symptoms tend to be mild. When these fruits and vegetables are heated, the proteins are changed, and for that reason the body doesn't tend to react to them in that form. So for instance, if someone has a birch tree pollen sensitivity, they may be more likely to react to raw apples. They may get itching in their mouth or tingling of their tongue. And when that food is eaten in the cooked form, so for instance if they were to eat apple pie, they seem to tolerate it fine with no issue. Other fruits that have been associated with this birch tree pollen include cherries, peaches, plums, and can even include some nuts such as hazelnut or walnut. The next question I commonly get asked is, can food allergy be outgrown? Allergies to milk, egg, wheat, and soy often resolve in childhood, Allergies to peanuts, tree nuts, and shellfish are thought to persist into adulthood. But that being said, approximately 20% of peanut allergic children will outgrow their peanut allergy. And finally, what is food oral immunotherapy? So for patients with underlying food allergy, quality of life is affected by fear and anxiety of exposure and possibly having a severe reaction. To help decrease this fear and anxiety and to help decrease their reactivity, some patients with food allergy may consider undergoing a food desensitization process, which is what oral immunotherapy is. The goal of this immunotherapy or desensitization is to raise the threshold of the food protein that causes a food allergy reaction. This is done gradually and cautiously over time and can take up to a year to achieve. Successful immunotherapy can allow one to eat a significant amount of the problematic food without a reaction over time. However, the problem food needs to be consumed on a regular basis to maintain the desensitization process. Our practice does in fact offer desensitization for peanut, cashew, walnut, cow's milk, egg, and sesame. I hope this helped you today. It was certainly a pleasure to speak with you regarding food allergy. If you have any questions or need any assistance managing your food allergies, please contact our office and have a wonderful day.